Okay, is it recording? Hello you guys, and welcome back to the Smashing Pots channel. Today we're going to do an extensive review of postural orthostatic tachycardia syndrome, also known as POTS. We'll be going through some scientific papers that I have already paraphrased in a senior paper that I wrote. And this will be a clinical overview of POTS. Okay, so we're going to briefly talk about the onset of POTS. The onset of POTS can occur from multiple factors. Most commonly, onset occurs after an immunological stressor on the body. So your immune system is your defense against the outside world or against invaders or attackers, right? And so one theory is that you have an immunological stressor on the body. What is an What is an immunological stressor? It's things like pregnancy, vaccination, viral infection, surgery, and psychosocial stress. All of these things will increase the activity of your immune system. The cause of POTS is not known, but current theories include autoimmune disorder, increased sympathetic activity, catecholamine excess, and sympathetic denervation. I'm going to break down what some of these mean because I know that they're kind of big words. Autoimmune disorder. This is when your body is attacking itself. Your immune system normally attacks invaders, but if you have an autoimmune disorder, then your immune system actually starts to attack your own healthy cells. This can lead to nerve damage or neuropathy, which is often seen in POTS patients. When we say increased sympathetic activity, your sympathetic nervous system is involved in your fight or flight response. So this sends out adrenaline and noradrenaline that gets your heart beating. So if you have increased sympathetic activity, that means that you have an increased fight or flight response, and that might be the cause of the tachycardia seen in POTS patients. Also looked at is catecholamine excess. Catecholamines are precursors to adrenaline and noradrenaline. So this is just another explanation for an overactive fight or flight response. And then lastly, sympathetic denervation. This is a loss of nerve supply, specifically to the sympathetic nervous system. And lastly, but not least, is hypovolemia, which is decreased blood flow. If you have hypovolemia, that means you have a decreased amount of blood plasma coursing through your body than the regular person, which of course will cause issues like POTS, because POTS is when you don't have enough blood getting to your heart to create a big enough stroke volume. You don't have enough blood that's able to make its way back all the way up against gravity back to your brain. Oh, okay, and lastly, we also have reflex tachycardia. I'm going to get more into the mechanisms of all of this a little bit later into the video. Right now, just get your ears wet, just kind of hear these words for the first time, and we will dive into them a bit later. So I'm going to briefly go over POTS demographics. Some of these are kind of old. The first ones I got were from 2008. So POTS is estimated to affect 500,000 Americans, with 25% of those being disabled and unable to work. It's considered one of the most common presentations of orthostatic intolerance globally. So it's not that rare. It's actually quite common. I think what happens within the POTS population is that it's on a scale. So you have some people with not so severe symptoms at all, and then you have other people who have the most severe symptoms of POTS. They're completely deconditioned, they're bedridden, maybe they're close to death. And then over here you have someone who still functions pretty well and maybe just feels a little bit off at certain points in the day, but not enough for it to be considered debilitating. Global prevalence studies estimate a range of 0.2 to 1% prevalence of POTS in developed countries, and POTS also affects younger premenopausal women between the ages of 15 and 45 years, with around 80% female predominance. So now we're going to get into the subtypes of POTS. It's really important to know why you have POTS, maybe what is the underlying mechanism in your body causing the POTS. Now, POTS itself as a syndrome all results in the same symptoms. Anyone who has POTS will have rapid palpitations, tremors, nausea, lightheadedness, anxiety, mental clouding, all of the common symptoms. Now what happens on this map is, here's POTS, and here's all the ways that you could develop POTS, okay? There's multiple pathways to POTS. Here, I'm only going to break down a couple. I'm going to break down the most studied subtypes that we have to get this information to you. So let's just jump into it. So the subtypes of POTS are really just descriptive classification schemes, okay? These aren't set in stone. These are still in theory. Like I said, physicians don't treat your POTS based off of the subtype that you have. I do believe that that is where the literature is going, though, so this information is still important. So these will be descriptive classification schemes. Keep that in mind. And what they represent are all these different etiologies, okay? So we're looking at all the different ways that these cluster of symptoms can develop. Subtypes of POTS include hypovolemic, neuropathic, hyperadrenergic, volume dysregulation, deconditioning, norepinephrine transporter deficiency, and mast cell activation. Hopefully you've already heard me speak on some of these words, so they're not that scary when you hear them. I know I've only explained them a couple times, but I'm going to go in depth and we're going to explain each type. If it resonates with you, go ahead and pause the video, look up more information on this, and hopefully I'm able to break down these vocab terms to where you're able to pick it up and take it where you need to take it. I'm going to insert this chart. What I'm looking at here is we're going to start at the left of the chart and then we're going to work our way clockwise around it, looking at the blue boxes as the main subtypes. So starting on the left, we have decreased NE clearance by NET inhibition. What that means is decreased norepinephrine clearance by norepinephrine transfer inhibition. So when you have norepinephrine released into your body, it is just going to chill in your bloodstream and it's just going to act on receptors and continually cause the fight or flight response. Now, how do you end a fight or flight response? There's specific transporter proteins that are supposed to pick up the norepinephrine and clear it out of the system. So if you have norepinephrine transfer inhibition, that means that that transferring system is inactive, which allows the norepinephrine to build up in your bloodstream, which means that the norepinephrine will continue to act on your body and cause the fight or flight response. So this is what is meant by decreased norepinephrine clearance. Now understand that norepinephrine and epinephrine are just types of adrenaline. You could also call it noradrenaline and adrenaline. So that's an easier way to really get in your mind that this is a fight or flight response. Adrenaline gets your heart beating fast and your body sweating. So if we follow the arrows from this blue box and then we go to the green box, we have SNS traffic. That is your sympathetic nervous system traffic. Remember, I said the sympathetic nervous system activates your fight or flight response. And so there's an arrow pointing up right next to the SNS traffic. That means you have increased sympathetic nervous system traffic. That means you have an increased fight or flight response. And right below that, you see an increase of plasma norepinephrine. Like I said, if you're not able to clear out the norepinephrine, it's just going to build up in your plasma. So let's continue to follow these arrows. Let's follow the arrow that goes directly to the right and hits tachycardia. So tachycardia would be a natural response that your body would have if your body was flooded with a continuous stream of norepinephrine that was never cleared out. Remember, think of it like adrenaline. Imagine if your body was flooded with adrenaline that could never be cleared out. Your heart would respond with tachycardia. So they're saying that this could be the reason for tachycardia in some POTS patients. I think this is very important, and this also will tie back to being misdiagnosed with anxiety disorders. So social anxiety disorders are different than when your body is having an actual biological response, such as this, where you just have an over release of adrenaline in your body. It's not due to any social circumstance. Your body's literally having a biological reaction. And that is why, well, I'll get into it later in the paper, but social anxiety versus anxiety seen in POTS patients has been detailed as different, and we will go over that. So following the arrows from tachycardia, we hit decreased cerebral perfusion. This is big. Decreased cerebral perfusion is what's going to cause your lightheadedness. It's what is going to cause you passing out. It's also what is going to cause your brain fog. So you might be saying, but you're in your fight or flight response. You have all this adrenaline in your body. Your heart is beating faster. How is there not enough blood flowing to your brain? Even though this gets into the anatomy of the heart, which I'll have a video that completely breaks down all of this. I'm trying to find simple ways to do it so it's not too much information at once. But what's happening is, even though your heart is beating faster, your actual stroke volume isn't increasing. So stroke volume is the amount of blood that your heart pumps each time it does a beat. So each time your heart is beating, it's going bodum, bodum, bodum. And the stroke volume is the dum, bodum. So the stroke volume is the dum, is how much blood is actually pushed out. And what they see in POTS patients is, even though you have this tachycardia, even though you have this excessive increase in heart rate, your stroke volume is actually low. And what that causes is a decreased amount of blood supply to where the heart is trying to pump it to. And so the brain actually can pick up on this, right? And this is where a negative feedback loop actually starts. The brain picks up on this low stroke volume and says, we need to fix this. We need blood to be pumped everywhere. And the only way it knows how to do that is actually to activate your fight or flight response, which is why you get the tachycardia. The unfortunate thing is that with POTS patients, no matter how much tachycardia you get, it's never going to bring you back to homeostasis because it won't be able to fix your stroke volume. So let's go ahead and move on to the next blue box. This one is going to be very similar to the last box that we saw. This one is primary increased sympathetic activity. Hopefully you know what the sympathetic nervous system does by now. It is the fight or flight response, baby. It is what is releasing the epinephrine and norepinephrine. So primary increased activity just means that you have an overexpression of your sympathetic nervous system. We don't know why that is. We don't know if it's because of a transfer inhibition. It's unknown, so we just call it primary. We just know that the main cause is an overactivity of your sympathetic nervous system, and it may have nothing to do with your norepinephrine clearance. So, and that, if you follow those arrows, they follow the exact same path that the last box did, so I'm just going to move on to the next blue box. This is called partial autonomic neuropathy. So we're switching away from the sympathetic nervous system, and now we're going to look at your autonomic nervous system. Remember, these control automatic functions that you don't think about, like heart rate, digestion, blood pressure, temperature regulation, breathing, etc. So what happens with neuropathy just means nerve damage. So if you have partial neuropathy, you have partial nerve damage to what? The autonomic nervous system. So remember how I said the autonomic nervous system controls things like heart rate and blood pressure? Well, if your nerves that control your blood pressure are damaged, that means that you're going to have inadequate vasoconstriction and vasodilation. This means that the veins in your legs, when you stand up, they're told to go like this, because this will create more pressure, allowing the blood to pump through quicker. But someone with POTS, when they stand up, the veins in their legs, instead of getting tighter and constricting, they dilate. And now the blood has less pressure to push against, so now it's fighting gravity because you've stood up, and it's also fighting this open space. What happens is the blood isn't able to fight against gravity, and it will fall back down into your lower extremities, and this is what we call blood pooling. This is also why the blood has a difficult time making it all the way back to the heart to give you a normal stroke volume, or even from there to make it all the way back to your brain. This is why you will get the common symptoms of lightheadedness, nausea, tremors, palpitations. And so let's follow the boxes to make this very clear. So under partial autonomic neuropathy, we're looking at the green box. So if you have nerve damage, this will cause inadequate vasoconstriction. This in turn results in blood pooling to your lower extremities. When that happens, you don't have enough blood returning to the heart, so that next green box tells you what is the result. You get a low stroke volume. You get decreased cardiac venous return. Since all the blood is pulling to your legs, you don't get enough blood back up to your heart, so whatever blood does make it back to your heart is a small amount, so your stroke volume is actually small. Remember what I said about a small stroke volume? The brain picks up on that, freaks out a little bit, and activates your sympathetic nervous system. So that is where you see the next green box. It's called baroreceptor unloading. This is a safety mechanism by your body. Your body is detecting that blood is pooling in your legs, or that blood at least isn't making it back to the heart. So it sends out a signal through your baroreceptors to tell the heart to beat faster. So you get an increased sympathetic nervous system, increased norepinephrine in your plasma. You get that classic fight or flight response, which isn't fun to have as a POTS patient, but It is what it is. So let's move on to the next blue box. Notice that this blue box feeds into the pathway that we just looked at, so I'm not going to go over all of it. Hypovolemia is just low blood volume. So maybe you don't have an issue with your norepinephrine clearance, maybe you don't have an issue with your sympathetic activity, maybe you don't even have nerve damage. But what you could have is just a decreased amount of blood plasma. So if you in your body don't have enough blood flowing through it, your heart will never have a normal stroke volume. And this will follow the same pathway that we just talked about. Last but not least are the autoantibodies. So this is going to be your autoimmune disorder, right? And also, mast cell activation would be grouped into the autoantibodies. As a side note, I know it's not on the diagram, but autoantibodies usually present with some type of rash or inflammation while you're also having your symptoms of lightheadedness. So when the brain detects that the heart isn't getting enough blood, you always have like this fight or flight response, and also that's usually when your symptoms will develop, because the fight or flight response doesn't fix the symptoms, it will just worsen them. Someone with a mast cell activation disorder will also have this flushing, is what they call it, or edema. So you'll just have spots of inflammation. Inflammation is heat, pain, redness, swelling, and sometimes loss of function. So if you have an autoimmune disorder that caused your POTS, your symptoms will be accompanied by these flashes of inflammation throughout your body. I don't know how well I explained that, but let's go ahead and follow these arrows. So this will just feed into your tachycardia. Autoantibodies can also cause inadequate vasoconstriction. Autoantibodies are antibodies that are attacking your own healthy cells, which means that they themselves can cause your nerve damage. So that just kind of feeds back into the loop that way.